do kidneys.
There.
Is that gonna bother you? Is it blasting in the face?
Okay, good.
You just take it.
Right. This is our patient. She's here for some right-sided pain. We're gonna look at all the things. All the things. Alrighty. So for our gallbladder, when they are supine laying on their back, I was telling everybody I kind of start with just where you get centered and situated on the left lobe of the liver, and then I will just sweep through toward the right to kind of see where it's at, because some people have a more anterior gallbladder. If it's more anterior, I probably won't even try this window just because I feel like I get a lot of artifact. I'll just go intercostal. And then if I felt like I couldn't see it this well, I can come through the ribs. And we have a nice little window there. Nice smooth wall. You don't have any of this bowel gas covering the fundus. And if I do see it really nicely this way, I will usually take one picture just to have it. Just the whole thing. And then I will say, big breath in, hold breath. And I will follow it out. More anterior on the body. Last one told me she only wants 2 pictures, so you would take your picture here with the whole gallbladder. Breathe.
And about 2, she means one where you can see the neck better. Is that what she means? But if you can take just one, would that be okay?
No, she'll still want to.
Even if you can see the whole thing.
Yep, because you'll still want to prove that there are any polyps or stones, like more lateral. Like where I work, I take 3. I will take a big breath in, hold breath. I will do this one where you can see like, okay, there's nothing, and then I like to come off one way so there's nothing there, and then I will fan the other way. And no.
Just like sagittally fanning.
Yeah, breathe. And then this way there's nothing, there's no stones, no polyps, no sludge hanging out over on this way. And then take a big breath in, hold your breath. Measurement, you want to have the wall nice and clean. Breathe. Just measure it. Going to the anterior to posterior. So if you hear me talk about AP measurement, it's all I'm just down there. And I usually do my gallbladder measurement in transverse, so when I have them take that last breath on the sag picture, I usually will spin really quick and try to get that one transverse picture to kind of utilize all of the breaths I have taking. Breath in, hold your breath. And then to find the neck, I will start by going to portal vein land, because I know it's a good place to look for it. So I'm going to have neck here. You want to try to get nice and circular. Earlier it was nice and circular and beautiful. I've rolled it around too much now. It's getting a little goosey in there. But if I was struggling to get a nice transverse and I wanted it nice and like circular, I could come through the ribs here and bring in your second rib, and you have a more clean wall. Another big breath in, hold your breath, and then you have which is usually, I feel like, a lot of artifact just because it's so small and it's hard to clear this out. If I had post-processing, I can use my TQCs and kind of ting it down that way. Any questions about the supine gallbladder?
Can you explain the when it's trans, how do you know fundus, neck, and
So I will go to the portal vein because you know you have the MILF that connects to the neck. So I will go here, and then I know that as I'm sweeping through the first part, I'm going to come across. We take a big breath in, hold your breath. So we have portal vein land, and then we're going to have the neck body as we go. Inferior on the body, because the way her gallbladder's laying in, and fundus is this way. Breathe. When in doubt, find a little vein. This is a good landmark. And then I will have you roll onto your side. I'm gonna have you scooch down toward the edge of the bed.
Okay. Keep going. Keep going.
Thank you. And then when I have her rolled, you're gonna be able to use the liver really nice for a window to clear out all the artifact that you might have seen when they were on their back. Take a big breath in, hold your breath. Long picture here. Just happened to your gallbladder in the last 20 minutes. Breathe.
For this one, we just need one picture.
I think they saw it was too sag to transverse again into cube also. So because her gallbladder went kind of funky when we rolled her, I would look at it through her ribs to see if it looks better, which it does.
You're looking just to get it as elongated as possible. Okay.
Elongated and then without any artifact, because sometimes the artifact can look like sludge.
Yeah, right,
And
okay.
so you'll want to try to get like a nice, clean anechoic gallbladder lumen. That way you know there's nothing happening here. No sludge, no stones, no polyps. You have that nice clean wall, no pericholecystic fluid happening. Spin on it. Big breath in, hold your breath. And then kind of the same deal again here. If you're trying to find your neck, you're gonna go find your portal vein. There. You have the neck. Breathe. So I would probably go up the ribs just to try to clear out some of that artifact on this. Time it with your breathing. Sending back and get a nice take a small breath in. Determined. And all of this is not perfectly circular. At least it doesn't have that artifact. There's no question about what is hanging out up here at all. Any questions?
So that was transverse, right?
Mm-hmm. Yes, for Shay, I don't personally bring it in that much just because I don't like the way it looks. I feel like it's too in the face, so I like a little bit of depth, but definitely do it the Shay way.
I mean, real world.
Real world scanner's choice. Like if you had a lot of depth, they would definitely call you about it. To be like, why did you do that? Like if I turned in a transverse picture that was like this, they would definitely be like, there's way too much depth in that. Like there's no need for it. But also like if you had it too close, a rad might be like, what? Why? So there's like a happy medium. Your eye, everybody kind of has their own preference. Some people scan darker, some people scan brighter. I actually felt like my ovary pictures were pretty like well optimized, and then my lead told me that she felt like I was from me shoving a photo at her face because they were too red stuff. So you know, everybody's got a preference. Alrighty, I'm gonna put some more gel on you here, and then for kidneys, I like to use the ribs as kind of my place to landmark myself. You always want to kind of instinctively come to the front of the patient just because that's how we see them when we're doing the liver. But then you can't get it horizontal and you'll beat yourself in the face trying to figure out why. I can get a straight kidney or I can have a cleared out kidney. I will come and run parallel with the ribs and kind of sweep up and down these bottom two ribs to see where I see it best. And as they're breathing, you'll kind of notice like, oh, if I rock my hand one way, it will straighten it out. Or if they take a big breath, it's going to pull it and then I can rock my hand. And so you'll kind of just watch it for a couple seconds just to kind of see the natural movement of it. And then take a big breath in, hold your breath. Now it's just like a little bit of probe maneuvering. I can have medial, mid, breathe. Take a small breath in, hold your breath. And this is kind of the risk versus reward that you will come across sometimes with kidneys and patients. Breathe. If you have them take a lot of big breaths in, it's going to stabilize your organs, but they're sucking in all that air. So by the time you get to certain organs, they're going to start being completely gassed out. She was not that gassy for the first round, and now her right kidney's like, and then for Shay, I know she just wants a medial, a mid, and then a lateral, so you don't have to worry about the far medial, far lateral, or high superior, low inferior pictures. But I did put those in my lecture because when you guys go to clinical, if you are with a majority of the sites that we use, they use the TRA protocol, and those are required pictures for them. So just so it's like at the front of your mind to do the far medial. For transverse right kidney, for superior, I like to still stay within the ribs. I feel like you get a nice, clean, circular kidney once you find it. Take a big breath in, hold your breath. So in here we have our superior right kidney. You would bring in your sector width, just kind of hide that rib shadow. Shay definitely does not want to see that. You have your mid here. Come a little bit more interior to get away from this rib. You have your artery and vein running in. Rock your probe down, and you have a nice inferior. And you would obviously bring up your depth and adjust your sector width. Breathe. Now, so in the last group, she's kind of a cheat patient because she swims and she's a lifeguard, so she can hold her breath longer than most people. Most patients only have about 3-4 pictures in them before they start to be like, oh. I think they're dramatic. I think they can probably get at least 6. But you know, you can't tell the 80-year-old woman that. Like, come on, Martha, you can hold it longer.
Suck it up.
Will you roll back onto your back?
Yes.
Thank you. In a pinch, if a patient is super gassed out, and lift your shirt up here this way. I have successfully imaged the kidneys this way. You can get them nice and horizontal and away from the rib. Take a big breath in, hold your breath. Beautiful kidney. I try not to do this though because it's terrible, and by the end my wrist will hurt. But sometimes it's so pretty you just can't help it. So watch your wrist if you're going to use this window while they're on their back to not be like cranked in there. Because
So this would be mid.
mm-hmm.
There's another shadow in there something.
Ideally you'd want to bring it out of the shadow. I just kind of left it there to show like more wrist placement because this all day, and then your arm is slightly rotated forward, and by the end of the day, like the front of your arm is going to be like, oh, that hurts. Definitely. Oh yeah, stretch. Yeah, look at that. Where was that 4 minutes ago?
She just needed to reset.
Oh, I'm gonna wipe this off.
Rolling in.
Yep, I'm gonna have you roll towards me, left side up. I've got you so grouped up.
Yeah, we're close. I didn't care about.
Good choice. Roll towards me.
Sorry, Angela.
Patient, did you just punch me? I might have to terminate your exam, man.
Harmony is free.
Alright, and then I was telling the class group for women, I find that a good window for the spleen is really just in this natural curvature that we have in our bodies. Like as soon as you put it down, like you're gonna only need to kind of adjust minor for the spleen. I don't know why this is what works for me, but I'll just be like, let's try there. For men, I do find that this angle still works, but I have to kind of come back a little bit more. I think just because their ribs are a little bit more round than ours are. So we have a beautiful spleen window here. That's it. And because she has such a good window, I don't even need her to take a breath in. I could just time it while she's breathing. And then sending back to cut out any of the motion. Corsage. Type anymore, won't measure, or I want to leave this. Nope. Bless you. And we're gonna measure from straight down this way.
What either anaconda at anterior?
This
No, at anterior.
here, or do you mean inferior this way? This is the spleen right here. This is all spleen. And then you'll see some of her ribs kind of coming through here and obscure it if she's breathing, or I go up and down. And then back here is the pleural space. You want to make sure that there is no pleural effusion, no major fluid happening. We have the transverse, nice and 180. A couple of you might end up working with techs who do a true transverse on the spleen. I'll be honest, I cannot teach you that. I have never worked with anybody who does it, but I have seen it and it always confuses me. Because I don't even know how they're imaging it to get it like a true, like, trans.
Yeah, because the ribs are in the way, right?
Yeah. It's a very strange looking picture and I don't understand it, but heads up, somebody might say, this is not correct. Do it when you get to clinicals, do it their way. For now, do it Shay's way, which is 180. So then you have your transverse, and you would measure from here to here again for your width and your height. Is going to go from the hilum straight back.
It's just 3 photos. I mean, 3 measurements.
Yes. And then you can also do the spleen left kidney window. This is not my favorite picture, but it is a required picture that I have to take. I don't think Shay requires you guys to take it, but I will usually do, we want to take this picture to kind of like the right liver lobe kidney picture, so there's no fluid in the right upper quadrant, but now we're going to do it in the left. But I feel like because of the ribs, I always end up with just something that looks like this and isn't very pretty. So I would rather do a dual screen where I'm showing you there's no fluid here with the spleen, and then I'll come around that rib and then show there's no fluid here superior to the kidney, like that area is nice and cleaned out. And usually where you find one, if you just come down a rib or up a rib, you'll find the other one. So then I have spleen here, I slide down one, and I'm right into nice long left kidney. And we have our far medial here. We have our hilum, medial, still have a little bit of our break, and then mid where it's all cortex surrounding. Lateral and far lateral. Little sliver of kidney. Any questions about that so far?
What either posterior structure?
This is aorta.
Hmm.
So if you're scanning a really big man, this is a good window to use because it is closer to your probe this way than having to shoot through liver, belly fat, IVC, all these things to get to the left side. So this is a window I use frequently at work just because I feel like I can usually get it nicely.
And what part of it is it mid or?
So
how do you
here
know?
this is prox aorta here, and then if you come down into kidney land, you have mid.
So it should be left medial, not posterior.
Well, we're technically coronal on the body because we're kind of angling this way through it. And you have
Kind of sagittal but curved.
And that is a hill some techs will die on. They will not annotate their pictures on kidneys as Sag. They will annotate it coronal anterior to posterior instead of medial to lateral like we do. And then her distal is just gassed out, but it would be right through here. But it's a very good window and a tricky AAA sitch. For left kidney, you will deal with a lot of the ribs just because of how it sits higher up there. Take a big breath in, hold your breath. So we're transverse. Try kind of angle in here. And then I'll bring my sector within on whatever side I think has the most rib shadow. If I can't get it completely out of it, like I would probably bring it in here. And then you have your mid, your little C. Hilum, inferior. Breathe. And the nice thing about the kidneys is once you can generally find a good window for them, you don't have to come out of it. You can just rock your probe through it so that you don't lose that nice clean border. Questions?
Thank you so much for doing it twice.
Oh, yeah, no problem. Anybody have any concerns, questions, worries?
Only concerns.
Because of ribs or just because
No,
of...
just generally.
Oh, that's... You're right where you should be then. Perfect.
I think the directional orientation is kind of tricky for me to picture.
I use the hilum, and I think of it as like a little mushroom house because it just has that little break there. I think of that as my medial, just because you know that's where everything's going to come in. And it's good too because if you scan through the back, things will flip, which will drive you crazy. Because now if I'm here, this is going to be her medial, and this will be lateral. And
Oh,
on
boy.
really skinny patients, you will have to go that direction. So I usually will use, like, if I'm confused on where I'm at, I will use the aorta and the hilum as like my, like, this is medial. Now I know which way to move. We have the baked potato, lateral. The mic exclusive there, I just stole it. And then if you come this way, you know your medial. You have your aorta and you have your hilum. That will come in time though, the orientation, as you start to kind of scan it a little bit, your hand will kind of start to feel like, oh, I'm moving this way, or oh, I'm moving this way. Anything else? Silence. All right, you guys are good to go then.